Hi, my name is Dr. Sunil Sharma. I'm the Director for New Life Surgical Associates, Jacksonville, Florida. In this video, I will try to explain what is hiatal hernia and what is GERD, gastroesophageal reflux disease. It's very common as you age. GERD is a combination of multiple symptoms. Patients usually feel significant heartburn, pain, often eating certain food, sometimes spicy. They also feel like if they have eaten food or dinner and they lie down, the food is coming up. They can feel that, producing a sour mash taste. Sometimes they wake up in the night choking. They may get aspiration because the food is coming up, may enter the lungs, microaspiration. They start coughing, may develop pneumonia. They may develop ear infection, sore throat. These are very vague general symptoms. So if you have these symptoms, you need a very proper evaluation. The first test would be an endoscopy. It's a simple few minutes of procedure. You're put to sleep, the camera is passed, and we can look at the anatomy. Very often we find what we call hiatal hernia, which is responsible for all these symptoms. So the question is, what is hiatal hernia? Hiatal hernia is a defect in the valve, which is at the junction of your food pipe, esophagus, and stomach. The function of this valve is to prevent the content of the stomach, which is usually acid or the food, coming back into the food pipe. So it wants a unidirectional flow. But if this valve is damaged, and it's usually damaged for two reasons. One, either the opening in the diaphragm has become too wide, so it cannot pinch it, or your stomach has been pulled up into the chest cavity. All these things can be diagnosed objectively using the endoscopy. And once you have a diagnosis of hiatal hernia and you have significant symptoms, since it's an anatomical defect, it can only be cured by correcting the defect. However, you can control symptoms by taking medications. You can cut down the production of acids, and there are many medications available which you can take, so you will feel less burning. However, you will still have food coming up which has the harmful effects, including development of Barrett's esophagus over the long period of time. And the disease is progressive. The symptoms get worse over the period of time. So the initial treatment should be breaking your meals into 4 or 5 small meals, not eating right before you're going to bed, but dinner should be 3 to 4 hours before you go to the bed. Sleeping in a propped up position, putting few pillows, these may help in symptoms. You can take medications, see if you have adequate control, although these medications have long-term effect. And over the period of time, once the weakness or the hernia starts, it gets worse and worse over the period of time. So the best treatment, once we know you have a hiatal hernia, have significant symptoms, is to repair the hiatal hernia. We do significant number of hiatal hernias. I personally performed more than thousands of hiatal hernia. And we repair using the robot because it's much more precise, safe, very straightforward, less chance of complications. There are 3 things which needs to be corrected when we repair the hiatal hernia. First, the anatomy has to be restored, meaning if the stomach is pulled up into the chest, we have to bring down the stomach and the food pipe, esophagus, into the abdominal cavity where it belongs. Normally, you should have 3 to 4 centimeters of esophagus in the abdominal cavity. This requires extensive dissection in the chest cavity, and with robot, you get the perfect visualization. Then you close the defect, the white defect in the diaphragm. You approximate the muscles so that it becomes a speed breaker and act as a wall. And then to prevent the recurrence and stabilizing, we make a kind of a small flap with the top portion of the stomach, wrap it and stick partially to the food pipe. So now this whole thing cannot go back. Operation is very straightforward, simple. Most of these patients, when done robotic, can go home same day, and you will find their symptoms is completely cured. They have a much better lifestyle. And more important, the long-term complications of reflux, including that of medications, or risk of pneumonia, or developing Barrett's esophagus and cancer, is almost cured. If you are suffering from heartburn, reflux, medications are not working, please call us. Our phone number is 904-399-4004 or visit sharmasurgery.com for more information. Make an appointment and we'll be happy to discuss further. Thank you.